we might have a longer break here in a little while. So welcome back. What I would like to do is introduce the PTA faculty that are here. So we have 2 other full-time faculty members that I believe most everybody met during the interview process. So Dr. Michael Strickland and Mr. John Lawler. And then we also have one of our adjunct faculty here, Ms. Cynthia Port-Dean. So I'm going to let each of them give a brief, quick introduction of themselves. So, Mike.
First, it doesn't happen too often, and I'll take it. So yes, I'm Dr. Strickland. You see me in quite a bit of your classes, like many of you probably know. I don't think everybody, I wasn't on every single interview, unfortunately, but I have a huge passion for teaching. It's what I've always wanted to do. But having said that, you know, I want you all to remember that I do expect a lot of you. I'm big on critical thinking. That is something that we're going to be talking about a little bit later on. And I expect you to continue to grow in that regard. And if you are struggling with the critical thinking aspect, if you're struggling with learning the material, I do expect you to come and get help with it. And if you're not, I'm not really in the habit of giving free passes or being overly understanding if you aren't trying to make the effort yourself. Okay, so we are very available, and I highly encourage you to come into the office hours and really take advantage of having access to us to the extent that you do, because I really want to make sure that you all are as good as you can possibly be. Every single one of you who makes it out into the clinical rotation, you reflect me as an instructor. Okay, that means I'm going to push you as hard as I can to make you the best that you can be, to reflect well on me. I know that's very selfish, but I don't care. That's sort of the point. Okay. But yeah, I've been through in physical therapy pretty much everywhere that you can be. So if you have any questions on any places that you might be wanting to work with or any special populations of interest to you, please ask, because I probably have experience with them. That's pretty much it.
All right, very good. Come on, John.
Hello, everyone. I'm John Lawler. I'm the academic coordinator for clinical education. So with that being said, as Dr. Strickland mentioned, you become a reflection of not only him, but the program. And also, it can end up being a working interview at times. Many students end up working in similar rotations. I will have to tell you right now, it is a very small world in therapy. I've been a PTA for over 20 years, and I have crossed paths with many therapists I've worked with in the past, not only in this state, but also when I was working in Michigan, and they have ended up in Arizona. So it is a small world, and you are representatives of the program and of the PTA profession. So the professionalism that Dr. Strickland emphasized is emphasized throughout the whole program. I also teach a few of the courses and assist with the labs. Welcome.
Very good. And then, Cynthia, would you like to introduce yourself? Oh, hold on, you're still unmuted here. Let's try this. There you go.
Thank you. A sincere and warm welcome to all of you. I may be partial, but I truly believe that you have chosen one of the finest programs that there are. The cohesiveness, the genuine caring about you as students is optimal. And I'm looking forward to working with you. Great success in your new program. Thank you.
And you will all be working with Ms. Port-Dean, because she will be your anatomy instructor. So you will spend many hours, if you have seen the schedule. with anatomy. Anatomy is the foundation for everything that we do. And the reason that we require you to take it here is for that reason, is that regardless of if you've had anatomy before, it needs to be so fresh in your mind that it is the foundation, is the cornerstone of everything that we do. And if you don't have that strong foundation, you're not going to be successful. So it is an intense introduction and reintroduction of anatomy. The last part of the anatomy course is PTA specific or PT specific. So the first 10 weeks, Ms. Pordine will be teaching you all the systems. And then the last 5 weeks, we will pull out some of the systems and delve into them a little bit more deeply. Okay, so definitely be ready for your anatomy course starting next week. Okay, so that being said, I want to share the schedule. So the schedule looks a little overwhelming. Get these out of the way. You can see that there are a lot of classes here because we have the 4th semester courses going on simultaneously with your 1st semester courses. So all of the courses listed here in different colors. So the Monday mornings, the Tuesday mornings, these labs, those are all the 4th semester courses. So you can kind of foresee what's going to happen in a year from now. Your courses are in the light blue. This doesn't show great here on the computer. Hopefully when you print it out, it looks a little bit better. But Monday, Wednesday, and Thursday, 1 to 4, is anatomy. Okay, so 3 hours, 3 days a week. Tuesday and Thursday mornings from 8 to 9:30 is your intro to PTA and ethics. Okay, that course is Tuesday and Thursday mornings. If you need to take your general education courses, they are also listed on here. So English and biology are the standard 1st semester general education courses, and those are held Tuesday for English and Friday afternoon for biology. So take a look at the schedule just to kind of let you know who's where and kind of a foreshadowing of what is to come in the next year. Okay, this is the busiest semester that we have because we have these two groups of students here at the same time. Okay. As you can see, these are all listed as virtual classes, minus all of these labs that we have for the 4th semester students. So also listed here are the instructors that are teaching those classes. So you can kind of get an idea of who's teaching what, so you can see that in the future. Okay. Are there any questions on the schedule? If you do not know if you need—
I have a question.
Yes, go ahead.
So the general education classes, like the English and the biology, I don't see that it says virtual on there. So is that also online?
Yes, those will
As
be
well?
virtual.
Okay.
Yes.
Okay.
And I didn't write them on there, but it is my assumption, because we are not coming back in large groups to campus yet. So
Okay.
I believe those will also be virtual. Regarding the virtual classes are just like on-ground classes. They meet at these specific times. So they are not like traditional online classes where you can just come in and do the activities or do the lecture, listen to the lecture at your leisure. Okay, the expectation is to be here, be in class at these specific times.
Okay.
Okay, so the anatomy 1 to 4 on Monday, if you have, everybody has anatomy, everybody has PTA 100. So those classes, you all will be together. And then for those of you that also need English and biology, that is Tuesday and Friday. Okay. Any other question regarding this schedule?
Yeah. So I'm not seeing where we're having the labs because it all says lecture
Right.
for anatomy and biology.
Exactly. So the anatomy lab is kind of combined into the lecture. So at this point, this schedule will be what you will be doing for the first 10 weeks.
Okay.
Okay. The last 5 weeks of anatomy, I will be teaching, and it will not be 3 hours a day, 3 days a week. I mean, yeah, 3 hours, 3 times a week. It will be shortened, and it will fit into those time slots, but the amount of time that we have for those PT specific content, the PT specific content for anatomy will be factored in. And at that point, we will figure out if we can come to campus or if we will still be in the virtual format.
Okay.
Okay. So I didn't add that in here because it's unknown at this point, but it will fit into these pre-selected time slots, just shortened. Okay.
Okay.
Other questions on this schedule?
Yeah, I have a question. When will we know if we need to take that English and biology class?
That is a good question. We will find that out today. Okay, when Steve Moore comes back and talks about the student services, there's a student portal that has your schedule listed in it. Okay, so he will show you how to access that. So he's coming back at 9:30. Okay, so that should be answered at that point. Good question, though. Anything else? No? Okay, the next item that I sent is the calendar, and you're probably wondering, why do I need a calendar? Well, I like to know when my breaks are. So here we are on August 24th to start. This first semester runs until December 12th, and my highlighting is not great. I don't know if you can see it, but we have a 2-week break at Christmas time, and then the second semester begins December 28th. Okay, December 28th will be the start of the second semester. That semester will run until April 17th. And then we have a 1-week break. Okay. And then the third semester starts April 26th to August 14th, and then we have another 1-week break. And this is where my highlighting doesn't show very well, but August 23rd would be the start of the 4th semester. That also is the first clinical rotation that you are on. So August 23rd through September 4 will be your first 2-week clinical rotation, and then you will return to campus or with the virtual environment, hopefully not the virtual environment, for September 7th through December 11th for the remaining of the 4th semester. And then the 5th semester begins December 27th and then ends April 15th. That would be the end of the program, the graduation. Now, that may not necessarily be graduation day, but that's when the program graduates. Okay, so you can kind of see where the breaks are. We have a week break between semesters, unless it's the December semester, and then we have a 2-week break. Okay, so that is the calendar that we use. Okay, so I wanted to give you the dark days. The darkened days are holidays, so we will not have school on those days. So you can kind of see where those holidays hit. Are there any questions on the calendar? That is just for your review, your benefit. No question? Okay, and then the last thing we're going to talk about is the PTA handbook. So the PTA handbook, everybody has this. Okay, we're going to spend a little bit of time going through the highlights of this. However, everything in the handbook is essentially important. It's critically important. This is basically what you're signing up for. Okay, the underlying theme for everything is that we are training you to be professionals in a professional environment. Okay, we expect professional behaviors. Professional behaviors are as critical and are as important as your academic grades. Professionalism actually is part of your academic grade. There's a professionalism rubric that we score you on every semester, and that is calculated through every faculty member that has you in class. We go through this rubric and grade your professional behaviors, and it is essential. And I cannot state it how essential it is, but it is the ultimate part of being a PTA and being part of the PT profession. So we don't take lightly these professional behaviors, and you will hear about them and you think, okay, whatever. But it's not really a whatever thing. It's of critical importance. So if there are professional issues, if there are professional behavior issues, those will be addressed quickly and adequately in order to help you learn the accepted behaviors. So those are expected in the virtual learning environment, as well as when we are working together. Once we get into some hands-on skills, you're going to work very closely with people. You're going to need to be able to work closely with people that may be different from you. They may have different beliefs, but you have to be able to handle that in a professional manner. So going through the program handbook addresses a lot of these issues. And this is where we are with the handbook right now. I will tell you that the handbook is being revised in a couple of ways. And once those revisions are made, we will send an update to the handbook and have you sign off on that to indicate that you understand the changes. And they won't be wholesale changes, but they will be more specific entities that we need to make sure that are addressed. This will help us to come in alignment with our other PTA programs within our college structure. So we want to make sure that all programs have the same philosophies and the same regulations. So that will be something that is coming. But what we have now is kind of the bones of that. Okay? So when you look at the goals of the program, it is to develop you ultimately to become a PTA. Okay, to pass that national exam and become to begin your career as a physical therapist assistant. Okay, then it dives into all the specifics of those objectives and how to meet those objectives and what our expectations are. Okay. Also, what do we expect, or as a student, what do you expect to get out of the program? Yes, you want to be a PTA at the end, or else you wouldn't be signing up for this. But what does that really mean? Right? These are the things that we know as program faculty. This is what it takes to be a professional in the area of physical therapy. We have to have the ability to communicate. We have to have the ability to conduct ourselves in a professional, compassionate way. Here are the full-time faculty contact information. We are always available. We scroll down through all the courses you're going to take, and then our professional association. Again, you are becoming part of a profession. This is not just a job. This is not just something to do, but you are becoming a professional member of society and of an entity that is there to help others. And our professional association of the American Physical Therapy Association helps assure that we have a job. It helps advocate for our patients. It helps advocate for us. So we will talk about this in the intro class, but it is important to be a part of our professional association. And then again, we delve into a little bit more about the specific policies. Okay, again, professional behaviors. You're going to hear this time and time again. Okay, we talk about it in the lab. We talk about it in the classroom. It's a little bit different when we're in this virtual environment, but we still expect that professionalism. We expect you to have your cameras on when we are in class. Okay, it is, as an instructor, it is the worst thing to talk to little black boxes with names on there. Okay, we need the interaction. We are all traditional on-ground instructors that are now in this virtual world. So we have to have that face-to-face interaction. Yes, there are times that you turn your camera off. That's okay. But understand that it is expected that your cameras are on and that you're paying attention, that you are interacting, that this is an active learning environment. We will not be reading PowerPoint presentations to you. Okay, if that's what is happening, I need to know, because that's not what we need to be doing. We need to have conversations. We need to have discussions on what is going on with the information. You need to be able to apply the information so that you know it and can learn it. A little bit later today, we'll talk a little bit more about how to be successful in this environment. What are the expectations? Well, first and foremost, it is that you're prepared for class, prior to class, which means that you need to know what we're going to be talking about so that we can have that conversation about it and not just expect the instructor to talk to you or talk at you for 2 or 3 hours. Okay, that's not a realistic expectation. Okay, the expectation is for you to have information and bring that forward. Okay. Success for the program. The level of passing is at a 75%. So you must pass the course at a 75% in order to pass the class. You also must pass the final exam with a 75% or greater in order to pass the course. Okay, let me state that again. You must pass the final exam with at least a 75% in order to pass the course. If you do not, you will have the opportunity to retake it one time. If you do not pass the retake of the final exam, you will not pass the course. You will fail the course. For any quizzes and other exams that are not the final exam, you still need to achieve a 75%. You will retake anything that you do not pass at a 75%, but not achieving it on the second time does not necessarily fail you out of the course. It is just the final exam that has that amount of power to it. Are there any questions on that? Okay. If you fail a course, you cannot go on to the next course. So if this semester we have anatomy and PTA 100, if you fail one of those courses, you are not eligible to move into the second semester because these courses are requirements for the next semester. And that's how every semester is built. So all of the second semester courses are requirements for the third semester. All the third semester courses are requirements for the fourth semester. So all of the courses build on one another. And that being said, the information builds on one another. So we already talked about how anatomy is the foundation for everything. Well, it is the foundation for everything, but it also has to stay in the front of your mind. Because once you get into kinesiology, the expectation is that you remember where those bony landmarks are. The expectation when you get into pathology is that you understand what the cardiovascular system does, so that you know when the system becomes not working appropriately, that disease process, what is going on in those systems. Okay, so our anatomy foundation is where we are learning normal function. Once we know normal function, now we can talk about the abnormalities that occur in the disease processes. Your rights. This is all of your rights. Okay, basically, you have the right to understand what you're getting into. Okay, this handbook is that. Okay, you have the right to receive feedback. You have the right to have open and honest conversations. Okay, we are there to help you along this process. Please reach out to us. Okay, we will be reaching out to you to help improve those lines of communication. Okay, so don't be scared if you receive a phone call from us. Okay, that's not 9 times out of 10 when we are calling you, it is just to check in to see how things are going. Okay, on a rare occasion, it's because you're in trouble or you're doing something that needs to change. But like I said, 9 times out of 10, our conversations are, how are things going? What can we do to help? Okay. Grading scale, attendance policy. You are expected to be in class. Dr. Elsie emphasized this at the very beginning. And typically, PTA students do not have a problem with this because the value of being in class is so great that if you are not in class, you will not pass. Okay, not only because of the attendance policy, but because of the amount of information and the volume of information and how quickly the information is being delivered. If you miss class, you are missing a significant portion of information. We understand that there are times that you are going to be absent. Things happen. People get sick. You can't come to school. Something happens. All you have to do is let us know. Okay, that goes back to that professional relationship that we have. Okay, you just need to reach out to your instructor as well as myself and let us know that you're going to be out. More about grades. If you are absent from class, then if there is an activity that is graded in that class, you can't make it up. Okay, so if you miss class, then you are missing opportunity to earn points on certain things. What about the conduct during testing? We typically are, well, at this point, we are doing all of our testing virtually. So there is a proctoring system that we use along with our Ring Central meetings. So we will get that set up and show you how to use all of that when it gets a little bit closer. Okay, there's no sense in delving into all of those nitty-gritty parts at this point. Practical exams. I'm going to touch on this a little bit because we don't really have a practical exam in the first semester, but a practical exam is a skills exam. It is for you to show what your competency level is for the skills that you've learned in that semester. So these are one-on-one skill exams. So there will be a patient scenario, and you as the PTA will treat that patient according to the plan that's provided. So again, you have to pass this with at least a 75%. And you have one opportunity to retake that. Again, this doesn't really pertain to these classes this semester, but moving into the second, third, and fourth semester, this is essential. And finally, the dress code. Again, in the virtual environment, the dress code is not as strictly enforced. However, remember that your cameras are going to be on and you should look presentable. Okay, you should look presentable. When you come to campus, you will be issued two polo shirts that you will wear as your uniform. Okay. It is not required that you wear those every day in the virtual environment, but please look presentable. Okay, don't have your pajamas on and lay in bed and act like you're learning information. Okay, I know there's going to be long days, but please try to get in an environment that you are set up for, set yourself up for success. Okay. So when we are in lab, there's a different rule for what you need to wear. We need to be able to get to skin and points on the skin, points on the body. We need to be able to touch skin to skin. So there will be times that you need to have the ability to either have be shirtless for men, or a sports bra or a tank top for women in order to get to different bony landmarks. So understand that you can't expect to palpate different areas of the body without touching those parts. Okay, and again, this goes back to professionalism. Everything that we do is a professional entity. So all of those interactions have to be done professionally. Safety, you can read through that. Security, field trips. Hopefully we'll be getting back to field trips. College ID, you should be having a badge made. Admissions will take care of that. If they have not reached out to you to get your badge made, be on the lookout for that. Okay, every time you come to campus, you have to wear your badge. Okay, every time you come to campus, you have to have your badge on. The campus is not open to just anybody to come in. Okay, it is expected that only faculty and students that are supposed to be there are there. Okay. Again, reiterating the importance of being, if you are absent, making sure that you notify me as well as the instructor. Either leave me a voicemail or an email in advance of the class if possible. Now, if an emergency happens, that's understandable, but reach out to me as soon as possible. Talking about communicating with your instructors. Again, we are professionals. We expect that you address your instructors in a professional manner, both via email as well as in person. So the expectation is that you address faculty members, you address members of the administration with a title. Okay. Dr. Strickland goes by Dr. Strickland. He has a couple of doctorate degrees. Okay, so it's expected that you call him Dr. Strickland. Mr. Lawler is referred to as Mr. Lawler. Ms. Portdean is referred to as Ms. Portdean. I'm referred to as Ms. Jackson. So unless the instructor tells you differently, It is expected that we are addressed via title. And that's just to show that level of respect, that level of professionalism. When you get into the clinic, if your supervising clinical instructor is a PT, typically they are going to have a doctorate degree. So they would be Dr. Strickland. Okay, so understanding that showing that level of respect is critical. It's critical for building that rapport and that relationship. That being said, if there is a name that you would prefer to be referred to by, other than what we see across the screen, please let us know. Also know that when you type your name in at the bottom of the screen, that everybody sees that. So make sure you keep that professional. You can change the screen name. So change that and make sure that it is something that is professional. I've seen students use some less than professional screen names, and they don't realize that I see those when they're using the breakout rooms, or they're using the rooms. But other members of the college sees that as well. That's also the same for your email. So your email addresses, you can use your Brookline College email, you can use your personal email, it doesn't matter, but make sure that the email, the name associated with that is something that is professional. So that when it pops up, it doesn't pop up as something that's not as professional. Okay? It's nice to see your name as opposed to a social media meme or something. Okay. I'm not going to go into the lab rules. Make sure that you read through those, or the clinical affiliation information, because that is several semesters away. Okay. The very last part of this handbook are the forms. Oh. And what I will need is that these 4 forms filled out and returned. I will let you know how we are going to do that. So the field trip waiver form, we typically have some field trips that we take. At this point, I'll just kind of have to see what we can do with those. But the informed consent, release of liability, that is definitely something that we have to have back, which basically states that you understand what you're getting into and the requirements of this program and profession. Talent release, if we have any videos that we take, pictures that we take, as well as acknowledgement of the PTA program handbook. So the last 3 are definitely 3 that we will have to have returned. All right, what questions? I talked a lot there. So what questions do you have regarding the handbook or the program or anything?
I have one.
Yes.
So I noticed that I can't remember, I think it was in one of the pamphlets, it said that we have to get a checkup and do a drug test. When is that? Is that like a due date, or are we just going to do that multiple times throughout the semester? Like, how's that going to work?
Yeah, that's a great question. So at this point, I know there is a health screening form in your admissions information. I would not do it right now. We do not need it until you start clinical rotations. So if you do it now, you are going to have to do it again. So unless this is the time that you do your annual physical, don't do it specially just for this program.
So regardless, like if you do it early, you just end up doing it again.
We're going to need it. If you do it now, we're going to ask that you do it again, because we need it every year.
Okay.
Okay. So you don't have to have it to start the program. We just need it by the start of the 4th semester. So in the 3rd semester, which will be next summer, is when we will be starting to start that process. That's the same time frame that we will be doing a drug screen. Okay.
And I'm going to add, Ms. Jackson, if I can, that you will be required to carry your own health insurance for clinical rotations also.
Yes. So health insurance, I was going to say about the drug screens. So Brookline College is a drug-free campus, which means that the expectation is that you are not on drugs when you're on campus or not, or partaking in anything. So if there is a question, you can be drug screened at any time. Okay. Everybody will be drug screened prior to clinical rotations. Okay. So we will be sending you out. Mr. Lawler has a whole list of things that are required. Your immunizations have to be up to date. So if you don't have those records, start gathering them. We'll ask you for them in that third semester. But if they are someplace else that you have to get them, start that process now. You don't have to turn them into us. If there is something that is missing, we will send you out to get that. If we need to have titers done for varicella or MMR, we will do all of that. But the expectation is that you are up to date on all of your immunizations. So again, that is something that as you get ready for those clinical rotations, we have a whole list of things that we have to check off. And we will take care of that and send you out for what you need. Any other questions?
Yes, I got one. What is the? I understand the polo, but what are the pants? What kind of pants are we allowed to wear?
Good question. So slacks.
No jeans.
Okay. No jeans. Okay. No scrubs. Slacks, khakis, something that is professional looking. Okay. No cargo pants. No jeans. No shorts. But slacks. Okay. I think it says in there khakis, but they don't have to be brown tan khakis. Khaki is more of a general term of slacks. They don't have to be dressy. They can be casual, but just not jeans, not cargo pants, not shorts, not sweatpants, not tights, any of those things. Does that help? Okay.
So the color doesn't matter then?
It does not matter. No. Your polo shirt, you will have 2 polo shirts and they are navy blue. Okay, so that's 2 polo shirts. If you're in a clinic, please don't wear them without washing them. So if you don't do laundry every day, you can wear another polo shirt. You can wear a button-down shirt. Just look nice. Okay. Again.
And footwear? Like sneakers, or do we have to wear a certain type of shoe?
Nope, shoes are fine. Just they have to be closed-toed. Okay, so you can't wear sandals, can't wear Tevas, but you can wear tennis shoes that are clean, not the ones you just mowed the grass in or went hiking in, but clean tennis shoes, loafers, whatever, anything that's comfortable. You are gonna realize that you're gonna be on your feet a lot, especially when you get into the clinic. Okay, you're going to want to have shoes that are comfortable to wear.
I have a question. So for some of us that have tattoos, we're required to wear the sleeves, correct?
You are, at this point, you are required to cover your tattoos. That's a Brookline policy. I will tell you that it is not strongly enforced.
Okay.
And when you get into your clinical rotation, plan to cover your tattoos unless your clinic advises you differently.
Okay.
Okay. So just kind of as a general guide, make sure that you are able to cover your tattoos.
Okay.
If you don't have to, then you don't have to. Okay, but be able to if you have to. Great. What other questions?
I do have a question.
Yes.
In regards to the 3 papers that we have to sign for the handbook, is it easier to just print them out and then email them to whoever, or?
You know what? If you all will print them out and then bring them to campus, because you have to come to campus to pick up your book for PTA 100. So if you, Kenny, you already got it. Absolutely. Fantastic. So if you haven't picked your book up yet, bring those 3 signed forms. And if you want to go ahead and sign the 4th one, that's fine. We usually do it right before we do a field trip, but for sure the 3, which is the liability, the handbook acceptance, and the videotaping form. If you sign those 3 and bring those to campus, you can give those to Susie at the front desk. She will give you the textbook. Nicole will have your goodie bag. Okay, so that'll be a great way. And if I don't get them that way, there's other means for me to get this information. So, but that would be the easiest way, especially if you have not already gone by to get the book. Your anatomy book is an ebook, so it will be in Moodle for you.
Is there a specific day we need to get that in by?
Well, classes, you will have to have your book before Tuesday because you need to have the first chapter read. So today is Thursday. The campus is open till about 4, from let's say 8 to 4. So I would suggest either today, tomorrow, or Monday, getting to campus and picking that book up. Okay. All right. Any other questions? No. Fantastic. Great job, guys.